Hello, I'm Dr. Jonathan Liss, and on behalf of Stork Medical, I want to send a special welcome to the doulas and midwives who feel a bit disconnected from the cord blood world. It's come to our attention that perhaps doulas and midwives are getting less attention than they deserve in regard to understanding cord blood and being invited to participate in the process. And what we're trying to do, beginning today, is start a series of conversations between our company and the midwife and doula communities so that we can make certain that you are comfortable with the cord blood process and help you decide whether it's the right thing to do for your clients and patients. Starting today, we've collected a series of questions that have been submitted by doulas and midwives, and I'd like to answer them. And on a regular basis, we'll be posting new videos for just this reason. You don't have to go to visit these videos in order to get your questions answered. You're welcome to call us at any time. As one of the principal medical directors, you may well be speaking to me, but certainly you'll be speaking to somebody with the knowledge necessary to answer your questions in a forthright manner so you can feel very comfortable with the advice you give your patients and clients and also feel very comfortable yourselves. So with that out of the way, I'll just go down this list of questions I have in my hand and hopefully give you some good initial answers. The first question is, how much cord blood really needs to be collected? And the answer is, kind of the more the merrier. There are two separate issues with the amount of cord blood collected. The first is organ regeneration, and the second is manipulation of the immune system. From a standpoint of organ regeneration, it is essentially thought that you need about 1 cc or 1 milliliter, if you recall those are the same measurements. You need 1 cc or 1 milliliter for each pound of the patient to fix a problem. In other words, to fix leukemia or to perhaps regenerate an organ. The more cord blood we have, the happier that we feel. Now, in this case, we are also looking for ways in which to regenerate cord blood stem cells. So it may be down the road that even a little bit of cord blood is enough, because if we're able to regrow cord blood stem cells from a patient's own sample, then even a small amount will be a lifetime sample. In regard to manipulating the immune system, there's been some very recent and some very important research in regard to how cord blood works. For decades now, we thought that cord blood stem cells were simply a way in which to repair bone marrow, or fix a brain, or perhaps give you a new heart valve. But recent data would say that cord blood stem cells actually manipulate the immune system to force the immune system to give out healing cells as opposed to damaging cells. And as you're well aware, many of the diseases that we're looking at have a bad immune component. In other words, if you have a spinal cord injury, part of the injury is the actual trauma that you felt, but a lot of the injury comes down to the fact that the immune system starts damaging the spinal cord further in its attempts to repair the damage or to stop bleeding. It turns out, at least from a research standpoint, that when you give cord blood stem cells, they largely go to the spleen and force the spleen to give out sort of a healing cell out of the immune system and suppress damaging cells. We believe this is why a series of I believe they're gerbils, actually recovered all their hearing, even though none of the stem cells went to the ears. I believe it's the reason why we're starting to see major breakthroughs in cerebral palsy and in autism and other diseases where the child is young enough that the brain is continuing to grow, and by suppressing the bad components of the immune system, that the brain is actually seems to be improving, at least from a research standpoint at this point. So in that case, we don't know exactly how much cord blood is necessary. It may be far less. Looking at your second question, it says, can delayed cord blood clamping be utilized and then extract the blood from the placenta? And the answer is absolutely yes. So sometimes healthcare providers will collect cord blood while waiting for the placenta to be delivered. They do that both because it's time saving and also because perhaps you can collect more cord blood in that way. But I know many in the midwife and many in the doula community would prefer to have delayed clamping, and that's perfectly acceptable. So after the placenta is delivered, the cord would be cleaned and blood would be drained from it. And there's no problem with that. That's been done many, many times. You'll see in a separate video, if you choose to, the way in which our kit works and some step-by-step directions on how to go ahead and collect cord blood, whether the placenta has been delivered or not. The third question is, does having a blood-borne pathogen cause the blood to be unusable? For instance, they wanted to know if you could use HIV-tainted blood or hepatitis C-tainted blood. And the answer is mostly it's not usable. You could certainly use it in the same individual, but you would not use it elsewhere. Now, we leave the issue of storing cord blood to the family. So when there is a problem such as this, we contact the family to let them know that there is an issue, and then they'll make a decision whether they want to put it in long-term storage or not. So the idea of whether cord blood will continue to be stored will be the family's decision. The FDA has certain guidelines about storing the cord blood. It just has to be in separate isolation vats, but it's treated exactly the same way otherwise. Number 4 is, why does it cost so much for storage? Well, there are a number of different issues. I have to say that this is a very technical process, and so transport costs, just getting the cord blood from the patient's house or the hospital room all the way to the laboratory, never costs less than $220, and sometimes costs as much as $500. That by itself is a large fee. The laboratory itself, the process, is an expensive process. Then, of course, we need to reimburse you for your time and effort in collecting the cord blood, and there has to be some small profit, at least for a company like ours. So all of that put together creates the price. Having said that, I want to tell you that Stork Medical is about 30%, well, maybe that's overstating it, but a good bit less expensive than some of the other prices that you've seen. And when we do our surveys, we find that most people think that cord blood costs about $3,000 to store, and that's far from the truth. Stork Medical, at this point, and it can change over time, charges $1,700 for cord blood storage, so much less than $3,000, but still a lot of money to any young couple. The next question is, if you store your baby's cord blood, can you donate it later to someone else? And the answer is absolutely yes. The person who has the cord blood is the owner of the cord blood until the baby is an adult. Once the baby is an adult, and then that young person will then be the owner of the cord blood. As a company, Stork Medical, or any of our rivals, so to speak, are custodians of the cord blood. We simply ensure it's safe storage, and again, eventually it's safe transport should it be necessary. Number 5, are midwives or doulas allowed to collect the cord blood if attending a birth at home? And the answer is absolutely yes. And one of the reasons why we've put together the associated videos that you'll be able to see on our website is to make certain that you feel comfortable doing it. You'll be able to get a step-by-step direction on how to store cord blood. You'll see each of the components of the cord blood kit. But in addition to that, you'll have our phone number, and you can feel free to call us at any time. We'll be happy to take you step-by-step through this. We don't want anybody uncomfortable. Our motto, and we say this to every one of our clients, which could be you, is that we want cord blood collection and cord blood storage to be the least stressful part of any pregnancy. We want this to be part of the joy of pregnancy, not part of the problem of pregnancy. Number 7 is, are there training videos on how to collect cord blood? Yes, there are. Please just see the next video. Number 8, if you store your baby's cord blood, can it also be listed in the cord blood registry? The answer is yes, but probably equally important. Once you've stored this cord blood, it belongs to you. You can do anything you want with this cord blood. And if you're thinking of putting it in the cord blood registry, you might, instead of storing it privately, you might want to make a cord blood donation. Certain hospitals will allow that. Most will not, but if you plan in advance, you'll be able to find a place that will pay for the storage, and they will be the custodians and the owners of the cord blood. In other words, once it is donated, it will no longer belong to you, but it's still a nice gift. And the final question for today, are there any additional risks to midwives or doulas when participating in a cord blood collection process? The answer, other than a needle stick, is no. So the cord blood is collected from the umbilical cord. The baby has already been disconnected. We have to have a sample from the mother, so that is a needle stick to the mother, and there has to be a needle injected into the umbilical vein. So both those opportunities give an opportunity to poke yourself. Apart from poking yourself, there are no other risks. And as you'll see in our cord blood kit section, we keep a consent form in the kit that the family has signed to release everybody of responsibility in this regard. So it is a procedure, and they have to have an informed consent, and that's what's given. And in that consent, we list the healthcare provider as being released from harm as well. So that's the end of our first video to the doula and midwife community directly. We welcome others. We welcome your questions. Please feel free to call or to write us should you have any further questions. Our phone number and our website information are at the bottom of the screen.